Do you have sleep apnea? Use a CPAP machine? It's important to use and clean your machine and accessories as directed by the manufacturer, which generally recommends you do so regularly with water and mild soap or detergent. You may have seen ads for alternative CPAP cleaners, ozone gas, also referred to as activated oxygen, and UV light-based products. Please be aware the FDA has not evaluated the safety and effectiveness of these products to sanitize or disinfect CPAP machines and accessories, which means the FDA does not know if ozone and UV CPAP cleaners work as advertised and are safe for home use. The FDA has received reports of coughing, difficulty breathing, irritation in nasal passages and mucous membranes, headaches, asthma attacks, and other breathing-related complaints from people who used ozone gas-based products. Exposure to high levels of ozone gas can also potentially make asthma and other chronic respiratory diseases worse, or increase your risk of getting a respiratory infection. In response to these reports, FDA scientists did some preliminary tests and found ozone levels above legal limits. They also found the ozone gas stayed in tubing even after the recommended wait times. As for UV light, it might not be able to effectively clean or disinfect CPAP accessories like masks, hoses, and plastic tubing. In fact, UV light may damage these components. Use caution if you're trying to clean your device with UV light, because use in some situations may damage your eyes, burn your skin, or increase your risk of skin cancer. The bottom line: follow the manufacturer's cleaning directions. Use mild soap or detergent and water to clean. And talk to your doctor if you think you have irritation related to using or cleaning your CPAP. One more thing: if you have a problem with any medical device or cleaning product, please consider reporting the issue to the FDA via MedWatch. See the description box to learn more, and please share.